we're celebrating Abida's 18th birthday and also Celergen's 16th birthday. So today is everybody's birthday. So ladies and gentlemen, put your biggest round of applause to welcome our VVIP into the hall.
All right. So now, guiding us through this conversation is someone with both depth of experience and clarity in teaching. We have Dr. Benedict Francis Valdecañas. We're looking forward to a meaningful and insightful session with you. But before we formally begin, okay, kindly type in the chat where you are joining us from tonight. Let's see. Wow, we have from Johor, Parañaque, Singapore, Taguig, Holland, Laguna. Welcome, everyone. See, it's always a reminder that while we may be in different places, we're all here for the same reason, to better understand our health. And as we go through the session tonight, feel free to type your questions in the chat at any time. We'll be addressing some of them later during our question and answer segment. Now, before I introduce our speaker, let me share this personally. I've had the opportunity to attend Dr. Ben's talks several times, and every single time I walk away learning something new. There is always depth, there is always clarity, and somehow it never feels like it's enough. Because the more you understand the body, the more you realize how much there is still to learn. And that's why tonight's session is something I genuinely look forward to. Our speaker, Dr. Benedict Francis Valdecañas, an orthopedic surgeon specializing in arthroscopy, sports medicine, and spine surgery. He has served as past president of the Philippine Orthopedic Society for Sports Medicine, past vice president of the Asian Society for Sports Medicine and Arthroscopy, founding chairman of orthopedics at Cardinal Santos Medical Center, associate professor with the European Council for Aging Research and Education. So tonight, you are learning from someone who not only understands the body clinically, but also knows how to translate that into insight we can actually apply. I invite you to stay present, listen closely, and take what resonates, because sometimes one clear understanding can shift the way we approach our health. So with that, it is my privilege to introduce Dr. Benedict Francis Valdecañas.
Okay, thank you very much, Kat. Is my audio fine? Anyway, everyone can hear me? Okay, so let's start sharing my slides. Okay, there. So tonight's conversation will be on the science of aging. Everyone is very interested here because everyone can relate. All of us will age, the rate of which depends on our mindset. So as you will see later, I will explain how this can be even altered, the rate of aging, based on the fact that the body heals itself. So for my disclosures, I have nothing to disclose. A disclaimer, I am not an expert. I do not claim to be an expert on the topic, but this is born of everything that I will be saying tonight will be born of 30 years of experience, both in the surgical and non-surgical intervention of degenerative illnesses or diseases. So if I may begin, okay, so we are all now concerned about the topic of longevity. In fact, this has been the topic of many documentaries across platforms and even talks and lectures and even businesses across the board. So if we're concerned about longevity, it's actually because we all want to live or extend this one life we are gifted with as long as we can. And interestingly enough, when the Human Genome Project ended in the 80s, this Time magazine cover came out because of that research, or born of that research, we were able to find out that the human body was actually designed to live to up to 150 years. And this is because of cell divisions and repair and tissue processes that I will be expounding on as we go on with the conversation. So as early as the time of Hippocrates, there was 400 BC, aging was already viewed as a disease, meaning lumped all together, the diseases that we see now and diagnosed on ourselves or on our loved ones, aging is practically the main or common denominator, the main factor for that. And this is because the human body ages because our cells, which make up the human body, age as well. So delving deeper, if you remember this diagram is from your grade school handbook or textbook of biology. So all the cells are specialized depending on the function that they are meant for. So you have your brain cells, of course, your liver cells for detoxification, your muscle cells for movement, blood cells for circulation, and your intestinal cells for absorbing everything that we eat, which will also come into fore later. So your cells are not really a haphazard mess or bunch of like these red blood cells in a clot. They are actually specialized and arranged into organs. Now, there are about 36 trillion cells. It's not very difficult to imagine that now as our economy goes into the trillions of dollars. So, out of these 36 trillion cells, these are all specialized and assigned specific functions all over the body. Now, it's also good to note that in our body, there are also 38 trillion bacteria. So we are actually a community in itself of 36 of our trillions of our cells and 38 trillion of bacteria in our gut and uh, distributed elsewhere. So imagine the genetic information in one human body that's made up of 36 trillion cells and 38 trillion, even more, bacteria. They have their own DNA. And all of this are synergistic and symbiotic. So how does the body heal itself? It repairs itself through what we call human stem cells. We are all born with it, such that when we were babies, we had a lot more, but as we age, these stem cells also diminish by number and by quality. So by the time you reach 80, you already from 1 is to 10,000 cells being stem cells when we were newborn. When we reach the age of 80, we only have 1 out of 10,000. So 1 out of 2 million rather, sorry. So they diminish by number and they diminish by quality or function. Now, why is this so? Because they are used up, depending on how you live your life, they are used up in the process of healing the body and regenerating our cells, tissues, and organs. Now, speaking of regeneration, how does the cell manage to do this? If I may be allowed to become a little bit more technical, cell division has many phases. So it's, as you can see on the screen, you have your interphase and then you have your mitosis and cytokinesis phases. The interphase itself is where the cell spends most of its time, particularly in the G0 phase, wherein the cell is at rest and just functioning and performing all its processes for the human body. So G1 is when cellular contents, except for the chromosomes or your DNA, are duplicated. And this takes place in a very slow and programmed manner. The S phase, after all the cellular contents, the cytoplasm in particular, are duplicated and regenerated, the cell now enters into what we call the synthesis phase. This is when or where the cell will now duplicate its DNA material, its genetic material. And all 46 chromosomes are duplicated by the cell in this during this phase of synthesis or S phase. After that, the G2 phase, G stands for growth, by the way, the cell itself checks and double checks that all the duplicated DNA material of good integrity and good quality and no errors are seen or are found. Once errors are seen, these are immediately corrected before the cell actually goes into division, which is the next phase, which is the mitosis. Mitosis is when the cell divides and becomes two. So that's the phase of cytokinesis. After that, after dividing into two cells or into more cells, which is also called meiosis, when the cell becomes four instead of two, This is very much common in the growing or the developing fetus or baby. So once the cell divides, that cell then specializes or differentiates into the tissue or organ that needs to be repaired or duplicated. So I expect a lot of questions being asked about this slide. So the cell division continues, becomes 1, 2, and then 4, divides through the cell cycle. Now, the interface is just one part of the cell division process. During the cell cycle, the actual cell cycle, the actual mitosis or cytokinesis, this is further divided into what we call the prophase, where the chromosomes condense and are coiled again, and metaphase, where the chromosomes align at the cell center before they divide, thus distributing equal number of genetic material or equal amount of genetic material into the two daughter cells. Anaphase, where these sister genetic materials separate and move towards separate poles before the actual division of the cell itself. And telophase is when the actual membrane of both the nucleus and the cytoplasm, parts of the cell, are divided and decondense. And then cytokinesis is the actual phase wherein the cells become two. So I hope that was clear. We then proceed now, after explaining how the cells divide to repair damaged cells. There is a phase wherein once the genetic material is deemed not healthy, the cell is, instead of dividing, does not re-enter the G1 from G0 and goes to a process known as apoptosis, or defined as programmed cell death. So when a cell is meant or destined for apoptosis, instead of dividing, it starts a process wherein it, well, short of or lack of better term, it goes into suicide or kills itself. So all these cellular material does not go to waste, actually. So after the cell dies or goes through apoptosis, all the fragments are either recycled or destroyed if they are not usable anymore. So all these cellular material are recycled and used by other cells and goes into the process of the repair. Now, why do cells have to divide or need to divide? When a part of your body gets injured, it becomes inflamed. You get a bump on your arm, it becomes bruised, it hurts, it becomes red. That's because all the cells in your bone marrow, which we call your hematopoietic stem cells, migrate to the injury site or the site of injury. And then it starts the inflammatory process wherein the cells are assigned specific functions to heal and immediately attend or address the injury itself. A concrete example for example, you have a cut. You're cooking something in the kitchen, you're chopping onions, and you inadvertently cut the skin of your finger. So the first cells or hematopoietic cells that go into the site are your platelets, or which are already circulating. So these platelets have two functions. One is to stop the bleeding, the blood clots over the incision site or the cut site. And as the platelets are clotting the blood, it also releases all these substances you see on the upper right hand of your screen. These are your interleukin-1, interleukin-3, and tumor necrosis factors. These are all what we call inflammatory mediators. These are chemical substances that the blood and the blood cells emit or secrete into the area of the injury. All of these inflammatory mediators have specific functions again. And most of them is to provide the baseline or the groundwork for healing that injured site of the body. Now, the more the body goes into an inflammatory phase, the faster it ages. So this is what we call chronic inflammation, when the body does not have a phase or a period that it is not inflamed at any other part, or at any one part of the body. So this is these are the consequences of a chronically inflamed body. So number one, your stem cells will get exhausted, and then since you always have the inflammatory mediators circulating in your bloodstream, you have altered intercellular communication. So instead of um, doing their particular or specific functions in peace, your cells start secreting inflammatory mediators, and this does not stop. It's just a vicious cycle that goes from one phase to the other. This causes a lot of other consequences like dysbiosis, wherein your gut flora, the good and bad bacteria, become imbalanced. Loss of proteostasis, wherein the proteins which are supposed to be made for hormonal production, for neurotransmitter regeneration, these are all put on the sideline, and the body focuses on the inflammatory process instead. This affects the integrity of your cells, particularly the genetic material. So this is when you get mutations. So mutations are practically um, uh, damage in your genetic material, your DNA. Every time your cells would divide, they're degraded one division after another. And this is what we call the telomere attrition. Telomeres are like the caps on your DNA, which are given out or given off when they have to divide. So the more your cells rapidly divide, the shorter your lifespan becomes, both in the cellular level and in the clinical level. Then, of course, you have epigenetic alterations, disabled macroautophagy, or your immune system is affected, and all of the other consequences of a chronically inflamed human body. This is very common, such that we even have a coined word called inflammaging. The more inflamed your body is, the longer it is inflamed, the earlier aging or the faster aging occurs. So the role of inflammation is actually very, very much proven and heavily present in the process of aging. So if you want to age slower, make sure that your inflammatory processes in the body are in check. So what are this? Anything that needs to be detoxified, anything that needs to be repaired has to be repaired immediately, uh, instead of just pushing you into a chronicity or a long-term inflammatory process. So with apoptosis, or your programmed cell death, this is actually the body's way of maintaining homeostasis or well-balanced health. So apoptosis is there to replace old cells. It strengthens your immune system by tagging cells which are not useful anymore. It gets rid of these not useful cells or damaged cells. It stops the damaged cells from multiplying. So cells that are damaged, if they do not go into apoptosis and they keep dividing, that's how you get tumors and cancers. And basically supports overall balance or homeostasis. That's the term that we use for maintaining your body's health balance. So when your damaged DNA is detected, the cell repairs it immediately right there and then before it is propagated into the daughter cells. So DNA repair in particular is to prevent mutations which cause disease. So prevention of mutation is equal to the prevention of disease. And this makes for the proper functioning of all your cells in the body. Now, this relates or magnifies itself through structure and performance of your body itself. So among these different factors, nutrition, toxins, immunity, hormones, and the most manifest is the structure or the physical appearance of your body. You start aging faster, you have lines at a much younger age. Weakness starts, and of course, general imbalance of the body happens. So among this, the structural is the most evident. And a good example of this, particularly in my practice, is when your joints, particularly for as an example, your knees become degenerated or degraded, which we call degenerative osteoarthritis. Now, frequent injuries into the knees will lead to chronic inflammation, which degrades the joint faster. And you end up with a knee that looks like this. You have denuded cartilage, you have bone spurs which grow in areas wherein there is undue stress. And then on X-ray, you can see more the joint space narrowing. So from something like this, wherein you have a space which represents your cartilage, into something like this. And this becomes more painful as you walk on it. But of course, this can be prevented, as you will see later on. Next is your hormonal integrity. So as we age, we notice or observe that our hormones decline, as you can see on the graph. But in actuality or in reality, it's the hormones declining that leads to our faster aging. So the more unhealthy you are, the faster or the earlier in your age that you uh, start having hormonal decline, and your body starts dysfunctioning and aging much faster. If you notice at the bottom of the graph, melatonin is there. Melatonin is an actual normal hormone that your brain secretes during sleep or in preparation for sleep. So melatonin, like any other hormone, will decline as you age faster. So uh, just to mention that sleep is very, very much important in managing the aging process. So your hormones, these are the ones that your body communicates from one cell to the other. They're they're very important that in building tissue and repairing tissue. They start declining with age by 50 to 80% depending on how you live your life. So the healthier you are, the slower your hormones will start declining. Progesterone, for example, starts to decline at the age of 30. So that's when you notice that your menstruation for the ladies starts becoming or starts changing. Estradiol disappears by age 50 when the ladies enter menopause. Of course, for the men, it's the testosterone that declines, and this can even happen earlier than the women. Men's testosterone declined as early as age 30, 35. So andropause happens at a much gradual rate. So the symptoms uh, associated with andropause are much less noticeable than that experienced by the ladies. Thyroid hormone or your hormone for metabolism starts to decline, both in the sensitivity of your body to the native hormone and the amount of hormone that is produced by your thyroid gland. This is when age 40, when people become what we call subclinical hypothyroid, meaning they have the symptoms of hypothyroidism, even if their thyroid hormones are within normal range if you test in the laboratory. This is a very important change, your insulin output, so the production of your insulin and your body sensitivity to your native insulin decline as early as age 30. So people can start developing diabetes as early as age 30 or even early 30s or late 20s. This is very much dependent on your dietary habits. If your diet is heavy on the carbohydrate side, particularly the simple carbohydrates, then your insulin becomes less and less effective in controlling your blood sugar until such time that your body builds up or develops insulin resistance and you start needing exogenous insulin injections as your doctor would prescribe probably. So that by age 50, we've practically experienced 20 years of hormonal decline. That's by age 50, which is only a third of the number of years that the body was even designed to live. If I were to show this diagram, this is what we call the hormonal cascade. You see on the bottom your estrogens, your testosterone, the sex hormones that are practically the most effective and most important hormones in the body. They're called sex hormones not because they're only responsible for sexual function. They're called sex hormones because they differ in quality and quantity in both sexes. So might as well call them gender hormones, but it means different now. So if you notice on the upper part of the diagram, there is a substance you are very much familiar with, cholesterol. So cholesterol is basically the uh, the the root molecule for production of all hormones in the body, including your neurotransmitters or the hormones of the brain. So that cholesterol is noticeably higher in the elderly, not because you've been eating fat, because excess fat that you eat, you only poop out. It's because your body is trying to maintain a higher level of cholesterol because it needs more and more hormones as you age through your years. I hope that is clear again. Okay. So basically, what is aging? It is the general decrease in body functions. It's when hormones decline that we start aging more rapidly, and enzymes and other substances steadily drop. So it's like nature sending, or the body, your body sending nature a clinical message to the cells saying that this is an old body and you can start to break it down. So this is when degeneration overtakes regeneration or the body's capacity to heal itself or repair itself. So when you talk about regeneration, you want it higher than your degeneration so that you age much, much slower. Regeneration is practically banking on your body's genetic design to heal itself. And this is how we can extend our so-called health span, not only our years, not only the years of our lives, but also the life in our years. Now, when you talk about regeneration, there's so much current therapies now out there. Thank you to stem cell research. So this is actually from cellular to molecular therapies. You have your hyperbaric oxygen therapy. I'm sure everyone is familiar with that. You hear it from your friends who are doing it. You see it in on advertisements. You also have your what you call your platelet-rich plasma, which is when the doctor extracts your blood, concentrates the platelets by spinning it in a centrifuge, and the platelets is then injected into an area of chronically inflamed injury. So that will uh, give your body a head start in treating an injury that has been long-standing, which your body itself cannot heal by itself. You have your exosomes, which are practically the contents of your platelets as cells. These exosomes contain all the healing proteins called peptides, your growth factors. And then, of course, there's also stem cells, which is very popular now and much, much widely abused, both in terminology and in practice. And lastly, but not the least, supplementation, which is actually available to anyone and everyone who wants to boost their regenerative capacity. This is practically supplying your body what it needs to repair itself. So, like I mentioned, exosomes are that part of the cell which goes out into the bloodstream or towards the injured part of your body, and they contain the proteins, the red bundles that you see on the upper right hand of your screen. These peptides are actually the healing factors or the growth factors that your body needs to start and complete repairing itself from any injury. So that being said, aside from all these regenerative therapies, what can we do as a normal, everyday, busy human being that does not entail much finances or much expenses, that we can do on a daily basis. Okay, so like we said, you start aging faster when you keep repairing stuff in your body. So to minimize the amount of repair that your body needs to go through, we should keep ourselves healthy, free from the insults that we put on it, both environmentally and nutritionally. And of course, that includes all the stresses and all kinds of stresses. So let's start first with what you can do to preserve your body's structure. One is regular exercise. And when I say regular, you I do mean preferably daily. So if you ask doctors who tell you to exercise, how regular should exercise be, they'll usually tell you 3 to 4 times a week. But there's an advantage for doing it daily, out of lesser intensity, of course, because your body is a creature of habit. So the results are more immediate. You can appreciate it better, and you keep the body healthier by constantly moving. The body was designed to move, uh, beginning from the prehistoric era when we had to run from predators. But now we are more sedentary. That's why we age faster. It's actually the lack of activity. So when you talk about exercise, all good exercise programs are composed of three parts. Number one is stretching. So before and after exercising, you should stretch. Stretching can be 5 to 10 minutes. It's that quick as long as you address particularly the tight parts of your body. Um, Stretching before the exercise prevents injuries. Stretching after the exercise prevents soreness so that you can exercise again the following day. Second important component of an exercise program is cardiovascular. This is any exercise that increases your heart rate and trains your body to a healthier cardiopulmonary function. Cardiovascular exercises, as recommended by the American Heart Association, should be 30 to 60 minutes of your target heart rate. You can compute your target heart rate uh, by subtracting your age from a constant of 220, thereby getting your maximal heart rate, and then uh, getting the 80% of that as your target heart rate. So when you do treadmill walking or running, when you do stationary bicycling, when you do your elliptical, monitor your heart rate that you achieve at least 80% of your maximal heart rate. And lastly, last component of a good exercise program is resistance exercises. Resistance exercises is when you lift weights, be it barbells or dumbbells or kettlebells, or just your body weight, like push-ups and pull-ups. So resistance maintains the tone of your muscles, which is very important in maintaining the manufacture of hormones. Next thing you can do is check your diet. Is it a well-balanced diet? But nowadays, after 30 years of seeing patients and talking about diet, I tend to believe there's no such thing as a well-balanced diet. Maybe we would better call it a well-curated diet. So in reviewing your diet, look at it. There are only three macronutrients that you have to check. Number one would be your carbohydrates or carbs or sugars, your proteins, and your fats. Usually, proteins and fats are associated together. Carbs are of two kinds, complex and simple. Simple carbs being your easily digested, easily metabolized type of carbohydrates, your rice, your bread, your pasta, such that they are so easily metabolized that you end up with a lot of excesses, especially if you do eat a lot of simple carbohydrates. Of all these macronutrients, the body only stores excess carbohydrates. Excess protein you pee out, given you have a healthy kidney function, and excess fats you poop out, given you have a healthy biliary and liver system. Carbs, however, if it excess, your body converts it in your liver to storage fat. So that's where you get your LDLs, your triglycerides, If they are going up, then check your carbohydrate intake in your diet. So here are some tips to manage your diet. We cannot get away from counting our calories. So do count your calories, and this is very much associated with the size of your meal, the amount of food that you eat. Number one, use a smaller plate. So this will definitely limit your caloric intake in terms of food. Second, use your plate to manage your macronutrients. So divide your plate into threes. Uh, most nutrition courses teach us to keep the 50% of that plate for carbohydrates. So preferably complex carbs. You have your vegetables, you have your fruits, you have your root crops. Those are your complex carbs. Try to keep that plate uh, clear of your simple carbs, your rice, your bread, your pasta, your noodles, and then a third of that plate should be your fats and your protein, which I said are usually associated with each other. So an example of this would be um, the steak, and instead of eating rice, steak with potatoes. That keeps your carbs in the complex category. So these are examples of food plate balance. If you want to lose weight, lessen your calories. If you want to maintain, this is a suggestion. And if you want to increase your weight, then of course you have to divide your macronutrients accordingly as well. So why do we need to supplement? Okay. Well, one, because not everything that the body needs to heal itself we get from our diet, no matter how well curated you think it is. So we need supplements to supply the body of everything that it needs to keep those cells healthy, to help the cells repair its damaged DNA, and to minimize division of your cells, and thus slowing down aging. So when you talk about supplements, you usually can get or take multivitamins or specifically certain vitamins that you think with the help of your doctor that you particularly need. There can be vitamin B's on top of your multivitamins. There can be vitamin D's and calcium for the ladies who are entering menopause to avoid osteoporosis. So those are just examples. Now, if you're under a lot of stress, which most of us are, then choose a vitamin or a supplement that contains a lot of nucleotides. Nucleotides in particular are the ones that or the substances that your body needs to repair your DNA. And through my experience in recommending supplements, there's still one that I've found that has a lot of these nucleotides to help the cells repair itself, its DNA, before dividing into apoptosis, for example. So Celergen actually has your uh, bio-DNA cell matrix. It's very natural from deep sea marine fish. It's biocompatible, easily absorbed by the body. It's very potent, as a lot of you probably have experienced already, and it's very safe. I have yet to see a side effect of taking the supplements for long term. So to deal with each and every major component of this supplement, you have your hydroMN peptide or your peptide N. The effects are one, they're proven to reduce the dietary glycemic index, meaning, as you see in this graph, your peptide N can really lower the reaction of your blood sugar uh, as early as 50 minutes after a meal. So it increases, in other words, it increases your cells' sensitivity to your native insulin by lowering the apparent glycemic index of the food that you take in. And the highest glycemic index food substances are, again, your simple carbohydrates. So this aids in maintaining a healthy body weight and reducing the risk of obesity, of course, which is very much common now, particularly in the Philippines. We are number two in both the rate of diabetes and obesity, second only to China, in Asia at least. So This prevents you or keeps you from developing type 2 diabetes, provided you also fix your diet. Next, you have your peptide E, which is a collagen component. This not only affects the collagen in your joints, but also the collagen in your skin. So again, this is the only supplement that I've seen which affects both types of collagens. Most collagen peptides out in the market would either address cartilage in the joints or just the skin being manifest, the less wrinkles, so to speak. So peptide E collagen is an anti-arthritic agent against progressive destruction of your joint cartilage. If you want to slow down the degradation of your knee cartilage, for example, as you saw in the example earlier, then this can help. It helps prevent damage to the synovial membrane or the the joint membrane due to chronic inflammatory process, which we call synovitis. If your knees are always stressed because of your heavier weight, then you have chronic synovitis, which is an inflammatory process that again can slow down or minimize the function of your knees over age. Next, we have the effect of peptide E collagen in the formation of your cancellous bone. This is very important and quite significant in people who are already in their menopausal age group. So osteoporosis is a very common condition that we see in this age group. So peptide E can help, but of course you have to take calcitonin, and cholecalciferol or vitamin D. And when you take these additional supplements, they have to be in the proper dose. Calcium is recommended at 1,200 milligrams per day, while vitamin D is now recommended at 5,000 units instead of the usual belief of 400 to 800. Now, peptide E collagen also maintains the skin's hydration, such as you can see on this graph. With 3 months of use of Celergen, the base hydration of your skin increases by 10% already. And this was shown in a study of 44 subjects, all of whom are above the age of 40. This helps in reversing the loosening or the relaxation of your collagen fibers. We get wrinkles because our collagen in the skin become looser. So this helps in the maintenance of dermal collagen for the toning and the lift. So for those who are already using Celergen, if you are enjoying the compliment of your friends saying that there's something different about you, then you can thank peptide E collagen for that. Now, last but not the least, the cellular effects of your biocellular matrix. This is actually a study done in 2013. It's a landmark study which shows how effective biocell matrix is or complex is in preventing your body into degenerating into tumors or cancers. Like I said, your cells that do not go into apoptosis when they should already, because they have a damaged DNA or genetic material, uh, they become cancerous or tumorigenic. So this is a study which looked at hep G2 cell proliferation in vitro in the petri dish. So what they did was apply Celergen's active ingredients on hep G2 cells, which are cancerous cells. And this graph showed the effect of a 73% reduction in the propagation or proliferation of these cells. This graph showed that with the help of this supplement, the apoptosis of the hep G2 cells increased. So cells which are dividing with the damaged DNA, they went into the apoptotic process when applied biocell complex. This shows 3 to 4 times increase in the activity of your P21 protein. P21 protein, or actually P21 is a gene which prevents formation of cancer cells, or prevents or pushes your cell into apoptosis if it has a damaged genetic material already. So 3 to 4 times increased activity of your anti-cancer gene P21. And then GAD 153 is actually a gene which also prevents the proliferation of damaged cells. So there's a 12 times increase in the activity of your GAD 153 gene as early as 48 hours. And then your oncogene is actually, as we always say, all of us have genetic code for cancer. CMYC is the most common gene for, as we call, oncogene or oncogenic gene. This is a genetic code in your base DNA that, if manifested or stimulated, it will cause the formation of cancer in any cell that it is activated in. If it's a liver cell, you develop hepatocarcinoma. So this study showed a 40% reduction in the activity of your oncogene CMYC or CMYC. This is a more recent study which focused on the P21 gene, and it increased activity of that gene, especially in a genetic strand that is damaged. It needs all the nutrients and supplements to supply the nucleotides with which your DNA or your genetic material uses to repair itself. There, your P21. Okay, so why are we so concerned about that? Not only because we aim to lengthen our health span, it is a actual fact that globally the number of 100-year-olds or centenarians is expected to increase tenfold over the next 35 years. So we are hoping that we are one of these people. So aside from being blessed with the genetic material that is helpful for healthy aging, a centenarian is somebody who balances all these factors very well. So you have your diet and your genetics. Particularly, as you can see, the diet is a very big part of that equation. Genetics can only manifest up to 20% of your life if your lifestyle is good. And then you have your environment, and then, of course, more importantly, you have to put exercise and supplements into your lifestyle. I think this is my last slide. Okay, so thank you. So I give the floor back to Kat, who will now manage our Q&A.
Thank you. Thank you very much, Dr. Ben, for that very insightful and valuable sharing. So if we take a moment to reflect on what we heard tonight, aging is not just about time. It is about what happens at the cellular level, and more importantly, there are ways to support the body's natural ability to repair and regenerate. So for many, this is where the shift begins, from simply reacting to health concerns to becoming more intentional about prevention and long-term vitality. So at this point, we'll open the room for a few questions.